Thank you for taking the time to learn about one of today's major health crises and how it may impact you personally. We will be presenting a lot of information. Please let us know if you have any questions. There are several reasons why you have been invited to watch this presentation. You may have been told that you will have sleep apnea and want to know about alternatives to CPAP. You may have a child with ADHD or who struggles with bedwetting. You may have a spouse who snores so badly that you sleep in different rooms. By the end of the presentation, our goal is for you to understand that all of these things that seem very different may have a common root cause. We start this presentation with a focus on children. As an adult with sleep apnea, at first it may seem odd that we are talking about children. We have learned that adults with sleep apnea very often had signs and symptoms as children. There is a good chance we may describe things that you struggled with as a child. Let's get started. There is a silent crisis in America. Research has shown that 9 out of 10 Americans suffer from one or more of these conditions shown on the screen. Unfortunately, many are suffering from these symptoms and feel helpless to find a solution. Attention deficit disorder, bedwetting. You're probably wondering why a dentist is talking about some of these conditions. By the end of the presentation, this will become clear. Take a look at these children. In your opinion, do they look healthy? Unfortunately, today, many might think that they look normal. Let me tell you what I see. The first child has a double chin and appears to be overweight. The little girl in the middle has dark circles under her eyes and looks quite tired. As professionals, we also notice her dry lips, dimpled chin, and lack of symmetry in her face. The boy on the right also has a double chin, dimpled chin, dry lips, and dark circles under the eyes. These 3 girls also show signs of not being healthy. All 3 show dark circles under their eyes and just look tired and sad. We note the lack of symmetry, the small chins, red blotchy skin, and an inability to close the lips over the teeth. Unfortunately, this is what a lot of our children look like these days. In fact, this has almost become what normal looks like. The question is, why are we seeing so many children who look like this? Could it be that there is a common cause behind the health concerns that we are seeing? What if these symptoms are linked to a compromised airway, resulting in insufficient oxygen exchange? Breath is life. Quality breathing is health. The top of the tree shows some of the symptoms we've been discussing. These are some of the things we may see and experience. The trunk of the tree represents a compromised airway as the underlying cause of these symptoms due to a poor quality of air intake. The root of the tree shows what can be causing the compromised airway and explains how we got this way. The children we just saw are examples of individuals with narrow dental arches and underdeveloped upper and lower jaws, which can be a main cause of a compromised airway. How does this happen? Why do we see so many children who have really crowded and crooked teeth? Why do 80% of our children need orthodontics? Why don't we see more young children that look like this 5-year-old with spaces between their baby teeth to allow room for their permanent teeth? Why has this become an endangered species? Is it that all of a sudden children have really big teeth, or is there something else going on? The important thing to note in this slide is that most of the growth and development of the head takes place in the lower third of the skull, which is made up of the upper and lower jaws. Normal craniofacial growth is wide, forward, and downward. The question is still why? Why is this normal growth pattern not seen in so many of us today? Research has given us the answers. Noted anthropologist Dr. Robert Corruccini has researched the development of the human skull. Next, we are going to look at his fossil and population studies. When Dr. Corruccini looked at human skulls from 400 years ago, he found that those skulls had bigger upper and lower jaws, and that there was room for 32 teeth in those jaws. There was very little incidence of crowded or crooked teeth, and there were no orthodontists around to make that happen. In present time, very few people have their wisdom teeth, and we don't even have room for 28 teeth without them being crowded and crooked. Dr. Corruccini studied groups of people who lived in isolated rural conditions. They were not exposed to processed foods and baby formula. They breastfed their children for 2 to 3 years, and their diet was comprised of hard, tough foods such as dried meat and hard root vegetables. Dr. Corruccini noted that these people had very little incidence of crowded and crooked teeth, and they had perfectly formed upper and lower jaws. He concluded from his studies that dietary consistency and toughness promote proper bone growth. When non-resistant processed food became ubiquitous after industrialization, malocclusion or crooked teeth show a rapid rise. Soft diet or processed foods increase underdevelopment of upper and lower jaws and malocclusion or crooked teeth. Dr. Corruccini observed as Western culture was introduced into these isolated populations, changes occurred in each generation. After processed foods and soft diets were introduced, there was an increase in malocclusion, crowded and crooked teeth. This slide shows the increase from generation to generation. Most of us think that the way we grow and develop is inherited. Dr. Corruccini's studies show that this is not always the case. Malocclusion is a disease caused by Western culture. We no longer breastfeed our babies for 2 to 3 years, and we no longer eat a hard diet. Instead, we nurse our babies for 6 weeks or 6 months if we can, and then we give them bottles and soft food, like baby food, macaroni and cheese, and chicken nuggets. Today, this is what our culture feeds our young children, foods that merely melt in their mouth. This is what we should be feeding our babies. They need to be able to utilize their chewing muscles and exercise their oral facial muscles and tongue to promote growth and development. Here is what we now know. Most malocclusion is acquired, not inherited. Malocclusion is unique to Western culture, and the presence of malocclusion is a key indicator of an underdeveloped airway. This is Dr. James Sim Wallace. Dr. Wallace found that an early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue, which cannot drive the primary dentition out into a spaced relationship with fully developed arches, which will lead to more crowding of the permanent teeth. We know that a strong, well-developed tongue is important in making sure that our dental arches, the upper and lower jaws, develop correctly. When your tongue is not strong and fully functioning, you will end up with a V-shaped Gothic arch and crowded, crooked teeth, as illustrated on the left. When your tongue is strong and functions correctly, you will have a beautiful U-shaped arch that has room for all of your teeth without being crowded and crooked. The orange part of the image depicts the maxilla, the upper jaw. Note that the upper jaw does more than just hold the upper teeth. It also makes up the sinus cavity and the lower orbits of the eyes. This researcher from Stanford University concluded that dental arch expansion improved sleep-disordered breathing in patients with upper and lower jaw constriction and can be a valid treatment. This demonstrates what our upper jaw looks like today compared to what they looked like in earlier times. This image shows a properly functioning airway with air entering through the nose, passing through the nasal cavity, and going behind the upper jaw into the nasopharynx, passing behind the tongue into the oropharynx, entering the laryngopharynx, on its way to the lungs. The upper and lower jaws are a major part of our airway development. An underdeveloped upper jaw will affect the nasal cavity and will keep the lower jaw from fully developing because the upper teeth trap the lower teeth and the lower jaw cannot expand forward to the correct position. When the lower jaw does not fully develop, it impacts the lower airway. What does your airway look like? What does your child's airway look like? Are you breathing through a narrow straw or a wide garden hose? The colored areas in these images show the airway. On the left, you can see how the airway gets severely narrow behind the tongue. The others show various degrees of narrowing. This video really says it all.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
This is Eli. We did not make this video, but it is a great demonstration of what a child looks like when they are struggling to get air when they are sleeping. After you watch this video, ask yourself, have you ever seen a child who looks like this when sleeping?
Now he's holding it. That was holding it. Still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. Still holding his breath. And now he's going to gulp again. There he goes. That was it again. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now watch what happens when I take his jaw and I just bring it forward. If I can, we'll see if I can. And I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose. And I've got his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward.
So what does this tell us? The development of the upper and lower jaws has a huge impact on how we breathe. Let's talk about the difference between breathing through your nose and breathing through your mouth. When you breathe through your nose, the air is warmed, filtered, and humidified. When you breathe through your mouth, you're breathing unfiltered, dry air. This can cause inflamed and swollen tonsils, which can further impact your ability to breathe. In addition, nitric oxide is produced in your sinuses. Nitric oxide is a vasodilator, which helps our bodies absorb oxygen. When you breathe through your mouth, the oxygen is not mixed with nitric oxide, so your body does not absorb the oxygen as efficiently. Nasal breathing is very important for our bodies and our health. Research by Dr. Harvold showed the impact of mouth breathing due to blocked nasal passages. Dr. Harvold found that nasal obstruction leads to mouth breathing and low tongue posture, which leads to malocclusion. The pictures on the left are pictures of the monkeys before their noses were blocked. The pictures on the right are after the monkeys were forced to become mouth breathers. Look at the differences in how the monkeys look after a short time. Here is what we know. When you have a compromised nasal airway and you breathe through your mouth, it leads to low tongue posture. It also causes tonsils and adenoids to swell. Dr. Sten Linder-Aronson did studies on children. He looked at children who were mouth breathers versus children who were nasal breathers, and he found that nasal obstruction leads to mouth breathing, which leads to low tongue posture and high rates of malocclusion. It is really important that we get people breathing through their noses. In fact, when you have a child who is mouth breathing and has a small airway, it impacts how the child is able to sleep and how they may experience restless sleep and nighttime arousals. When a child does not get a good night's sleep, it can manifest signs of attention deficit disorder. This is Dr. Ben Miralgia, and he is going to share how airway and sleep may be linked to ADD, ADHD.
take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD. And our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep-deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. And one of the pioneers here is Dr. Stephen Sheldon out of Laurie Children's Hospital in Chicago. And he does a wonderful job of researching. And over the decades, he's come to a conclusion, and I've seen him speak. And it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonuk out of Einstein at Yeshiva University. Dr. Karen Bonuk has the largest study to date. 11,000 children were watched over 7 years. And they were divided into 2 groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children.
This is the research that Dr. Maralgia references from Dr. Karen Bonuk. She studied 11,000 children over 6 years, and she found that there was a strong and persistent association between sleep-disordered breathing and diminished IQ. She also found that sleep-disordered breathing increases the risk of being diagnosed with ADD, ADHD by 50%. Now you may be asking, how is this all connected to bedwetting? Dr. Maralgia is going to explain the connection between bedwetting, airway, and sleep.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night. But it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on the rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed.
What can we possibly do? It may not be what you think. This video was made by Connor Deegan's mom. It is a very powerful video on how airway and sleep impact a child. So how can dentists help? This is Hunter. Hunter struggled with bedwetting. When you look at his teeth, he has a deep bite and no room for his permanent teeth to come in. Now we know that this is a sign of underdeveloped upper and lower jaws. This is what he looked like after 10 months in treatment, and he stopped wetting the bed after just 1 week in treatment. Why? Because he was able to breathe better and sleep better. This is Paige. Paige also had a deep bite and a lot of crowding. This is what Paige looked like after treatment. Look at the beautiful development of her upper and lower jaws. Remember Michael? This is Michael at age 9 and then at age 14 after treatment. Look at the difference in Michael's teeth. Michael's airway is the dark shadow between the jaw and the spine, and you can see how much bigger it is in the after picture on the right. If only we had known. What about my child? What about my spouse? What about me? Meet Dr. Tara Griffin from Florida. She is a dentist and she was her own first patient. She's going to share with you how she transformed her life and her practice.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos Appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well, waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos Appliance. As soon as I started treatment with the Vivos Appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos Appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos Appliance is worn in the early evening or while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that can help you.
I wanted to share this image of an adult patient that was treated with an appliance. Look at the difference in the airway volume. He started at 7.7 centimeters, and after 15 months in treatment, the upper airway increased to 24.1, almost tripled in size. Here's another adult case that I wanted to share with you. Look at where this patient started, with a long, narrow, straight face, and it looks stretched. As treatment progressed, you can see her transformation into a prettier, younger-looking person. She almost looks as she had surgery. This was all from oral appliance therapy. Here are some patient testimonials. When smiling, I notice that I am now physically unable to smile as big as I used to. My gums are now barely showing. My face feels different when I smile now. I don't know how to explain it, but it's a great thing. When I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose now. I am very happy with the results. When we expand the dental arches, we promote healthy nasal breathing, train the tongue, and eliminate bad habits. What does that mean for you here in our office? If you have identified that this treatment is right for you or a loved one, we invite you to schedule an appointment to learn more. Vivos is a treatment system made up of screening, medical imaging, and diagnostics. We will take a series of scans, photos, and go over medical history information. We will sit down and discuss an integrated plan that works best for you. This treatment can include oral appliance therapy. There are a few different options for you. Each appliance is designed specifically for the patient. As we discuss your comprehensive treatment plan, we may be including a myofunctional therapist, ENT, or chiropractor. In our practice, we believe it takes an integrative approach to your health and well-being. We work with innovative, state-of-the-art patient treatment technology. One of these technologies that we use in our practice is a home sleep test. Again, if you feel that this treatment may be right for you, please get scheduled for a private screening with Dr. Barthman. I'm going to show you one last video. After the video, if you have any questions, we are here to answer those for you.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well. If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life. The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time. Along comes Vivos and says, wait a minute, we have a better option. that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple of weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile, and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down. He's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this. And I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself because now the body can breathe and sleep well. That's exciting.
Thank you for taking the time to invest in your health. We are here to help improve the quality of your life. Please contact us at 650-367-4967.